ready now, but she's singing the lines in the top of there's rice. No, baby, the pie. But she had potato earlier. But yeah, I put that left the oven. Oh yeah, eat some, yeah.
We're live.
Okay. Good evening, ladies and gentlemen. Thank you for tuning in this evening for our Windrush Health Legacy COVID-19 talk on uncertainties and experiences. It really is time to talk. And today I am so happy to invite two guests to our platform. We have two great guests in our platform today to speak on COVID-19 and the vaccination. First of those guests is we have Donald Palmer, who is an associate professor of immunology in the comparative biomedical sciences. He is going to come across to talk to us a little bit about the background of vaccinations. He's going to give us a presentation at the start as well to sort of set the flavor and set the agenda for tonight's discussions. And I'm so happy to invite him on the line today. Thank you very much for joining us. And then secondly, we've got Dr. Dorian Cooper, who's a GP working in Bedfordshire and Hertfordshire. And he's going to talk to us again about sort of from a GP perspective, his experiences about the COVID-19 pandemic and also the vaccination program. So gentlemen, thank you very much for coming on to the program this evening. Welcome. I'm really passionate to sort of talk about this. I mean, to be fair, we've avoided this topic for the past few months now, but I think it's now really is that time to talk. So thanks for coming this evening. Welcome.
Oh, welcome, David. Thank you for the invite. It's a pleasure to share the platform with such amazing individuals. Thank you.
No problem at all. So I think first up, what I'd like is Donald, if you could just share your screen for us this evening, and then talk to us a little bit about obviously COVID-19, some of the I guess issues in regards to the vaccination, so we can enlighten our intelligence with understanding how this vaccine came to fruition.
So thank you, David. So hopefully you can see my title slide. Is that correct?
We can see it. Yep, we got it.
Brilliant. There. Okay, so can I say again, thank you to the organizers for allowing me to speak. I'm going to speak for about 10 to 15 minutes. And I really just want to talk about how the immune system works and why we sometimes need vaccination. And the most important thing I really want to get across is that I'm not here to tell you to take the vaccine or not take the vaccine. I really just want to provide you with some factual information so that you can make an informed decision. Just briefly about myself, I'm an associate professor of immunology, and I've been involved in immunology for over 30 years. I'm also the Education and Career Secretary for the British Society of Immunology, one of the largest group of immunologists in the world. And if I have time, and this might come about, just over 2 years ago, I was on one of the working group for the yellow fever vaccine for the Medicines and Healthcare Product Regulatory Agency, better known as MHRA. So you may have heard of MHRA. And if that comes up, that's a regulatory body. I've actually worked on that body, and I'm happy to share my experience. So here's the first slide, which is really asking the question, what is immunity? So overall, ladies and gentlemen, brothers and sisters, the function of our immune system is to protect us from disease. So germs, what we call microorganisms, can infect us and primarily cause us harm, cause us disease. And they're able to do that through a number of different routes. One is if your skin gets cut. So your skin is a really important barrier, but once your skin gets cut, germs can get in, all right? Another way germs can get in is when you take in food, contaminated food. That's food poisoning. Another mechanism is basically through what we call the nasal pharynx system. Classic one for that is, flu, or currently the situation is with SARS, COVID. So our immune system is incredibly important. And I found it fascinating is why I've been studying it for a number of years. And we have a number of different barriers. So we have what we call our frontline immune system. The skin is an important barrier, but even the acid in your stomach, it also forms a level of protection. The gut, the lining of your gut or the lining of the mucous airways contains mucus, and even the tears contain products that can protect the body from germs. But if the organism breaches that, then you have your white blood cells. And you may have heard the term T cells and B cells as been talked about by COVID. And these cells play an important role in protection. One such cells are called B cells. And the key thing to think about these cells is they produce a soluble protein called antibodies. And we've heard antibodies being incredibly important for our protection. But let's take a step back. To ask the question why antibodies are important, let's look at why viruses can cause harm. Why do viruses really make you ill? So the thing about viruses is that they can't divide outside the body. So how viruses work, as you can see from this slide, they attach themselves to our cells in our body. They get inside our cells, and they actually use the cell machinery to make these viral particles, to make viral proteins. And during this process, they cause destruction of cells. So that's how, and that causes what we call inflammation. It makes you ill. So an important part of our protection is the production of these antibodies. And as you can see from this slide, what happens, antibodies coat the virus. And by coating the virus, and by doing so, it actually prevents the virus from getting into your cells and, more importantly, preventing cell destruction. So antibodies play a particularly important role. But there's a problem sometimes in our body's defenses. So how our body works is that it makes these antibodies. This is quite a complicated slide, but the essence of this slide is that when we see a bacteria or a virus or a toxin for the first time, that initial exposure, our body actually takes a while to make these soluble proteins. Now that variation of time can depend on a number of factors: diet, age, or other sort of other comorbidities. But when you see the bacteria or the virus for the second time, that's called a second or third exposure, your body now remembers that response, remembers it, and the response is now greater, quicker, and higher. That's referred to as immunological memory. And that's really what vaccines do. It's providing that window of making sure your body has already made these antibodies so that when you now see that virus, you now see that bacteria, your body can respond quickly. Because one of the problems, as you can see, in the early phases of when you get infected, the virus can rapidly divide and can, in some circumstances, cause real harm. So the idea of producing vaccines is that it can aid. And on the slide here, you can see there's a whole host of viruses that can cause harm, but scientists have successfully made vaccines so that they can produce antibodies. And what vaccines really are is that they mimic a response. They're not the actual particle or the germ themselves, but they mimic it, so they train your body. And what happens, you make these antibodies. So now in circulation, you have these antibodies that can then, cause and make sure your body is protected. And we know the importance of vaccines. This is just one example, and there are many examples of how vaccines in general have worked. And I'm sure many of us here watching have had childhood vaccinations. WHO have shown, and there's data to suggest, that many millions lives have been saved because of vaccination. And one of the reasons why we've got a greater life expectancy now than, say, 100 or so years ago is not only diet, but also vaccination. So vaccination is an important vehicle in protecting us from diseases. And we've heard the term herd immunity. So what does that mean? So the idea of herd immunity, and it really relates to being vaccinated. We now hear sometimes it referred to when you're being naturally infected. But remember, if a disease can kill you, it's not necessarily the term herd immunity should apply. But how viruses sort of spread can, as we've spoken about before, is through sort of contact, through the aerosol. And so if there are very few people that have been vaccinated, then the virus has the ability to spread. But if more and more people get vaccinated, the spread is contained and the spread is limited. And we know this works because when we look at, for example, of smallpox has been eradicated since 1981, and subsequently now no one needs to be vaccinated, and that's how you eradicate a disease. So that sort of brings the end of a general talk about the immune system. I just want to spend the last couple of minutes talking specifically and some of the questions that we've received around sort of COVID-19 vaccine. And I want to take a step back and talk about how medicines are made in general. So the medicines that we consume in our bodies, how are they made? So at the very early stages, there's testing in the lab, there's testing on animals. So before any drug is given to human consumption, they're actually tested in the lab and on animals. And then they go through a series of different stages, which you may have heard of, known as phase 1, phase 2, and phase 3. Phase 1 really relates to looking at safety. And as you can see on this slide, very few people are used in this study. It's just to test whether or not, this drug actually sort of circulates around the body. Is it safe? Then phase 2 will then look at it more, not only in terms of safety, but now asking, does it actually have some aspect of activity? That's phase 2. And you can see the numbers are now 100 plus. Whereas then in phase 3, which is a massive now clinical trial, there are now several thousands. Once all this data is collected, volunteers are organized, then it goes to the regulatory body and they review all the data. And in fact, as you can see on this slide, it can take somewhere up to 2 to 10 years. But remarkably, the COVID-19 vaccine has taken much smaller. And I'll explain why. So let's look at these 3 vaccines. Let's look at their ingredients, their efficacy, but also the number of people that were involved in sort of these clinical trials that we spoke about. So in a normal drug, there's about 100 in phase 1, 1,000 or so in phase 2, and maybe 10,000 or so in phase 3. One of the things with these vaccines, and the ones that are currently being given emergency use in the UK, is that several of hundreds of thousands of people have actually participated in this phase 3 clinical trial, largest ever. One of the questions that often asked is about the demographic of people that have taken these vaccines. And what you'll see is the fact that these clinical trials have taken place world over, and diverse population, not only in race and ethnicity, but in geographic location, but also in age. Okay. I've put here both the ingredients in case people want to know they're about, and the main ingredients for the Pfizer and the Moderna is the messenger RNA, the lipids, the salt and the sugar. And again, we can discuss these, in the Q&A. And there's also the side effects that I'm sure the Dr. Dorian Cooper will talk about. But another question people have often asked is, given the demographics, what else is there about those participating in the clinical trials? And this is one of the papers that have published some of this data. And I should point out, that with all the slides, please look at the links, because that's where the majority of the data has come from. But what I want to stress, in one of the clinical trials, up to 20% of the individuals had a wide range of diseases, such as diabetes, cardiac disease, etc. So the clinical trials were actually taken on the general population. And that's something really to bear in mind. And here's one of the several reasons why this vaccine was developed so fast. One of them is around the huge collaboration that took place with scientists, not only national, but international. The identity of COVID-19 and the publication of the sequence, i.e. what it's made up of, was really delivered and made available to the scientific community very early on. The funding, a huge number of funding took place. I also want to really point out the science behind this. The science behind the development of these vaccines has been going on for many years. We have to remember it uses the same technology as Ebola and rabies. So this is nothing new. So this technology has been going for a number of years. But also what's been remarkable is the number of volunteers that have actually taken part in these various trials to increase our understanding. And finally, the question is, do these vaccines work? So this is the data that's literally come out in the last couple of weeks. There's the newspaper links as well as the journals that take place. So one question, people have said, this is an experimental drug, we don't know if it works. So here's the current data. And some of the data is now actually coming out from this country, from Public Health England. One of the things they've noticed now, in terms of that, it does reduce transmission. So evidence suggests now, and they've been collecting this data, it shows it's reducing transmission, okay? But it's also a case, and they've been looking at this, particularly with the first cohorts that have been vaccinated, these are the over 80s, to show there's also a reduction of COVID in terms of cutting serious illness. So it does look like these vaccines work. These vaccines are safe. And more importantly, there's nothing in the case where any of the safety have been compromised. It's really been around the technology. And also I should point out, lastly, is that, as I said, clinical trials are done in series. What's been remarkable about this development of these vaccines is that they were done in parallel. And as soon as the data was made available, it was then looked at by the regulatory bodies. So it's been I have to say, this is one of the uniqueness, and it's been very unique in how they've done the clinical trials and then done the examination of the regulatory process. But there's no point as safety being compromised. So I'm going to stop there so that folks can ask questions, and I'm hoping Dr. Cooper can also comment. Okay.
Fantastic. Thank you so much, Donald, for sharing the insightful knowledge about vaccinations, going through history all the way through to productivity of the vaccine itself for COVID-19, also relating that to sort of the past vaccines that have worked so effectively and efficiently in sort of helping with other issues and problems and concerns that we have. So I think that's a fantastic sort of presentation. Thank you for joining us on the Jamaica Diaspora UK and giving us your time and insightful knowledge in regards to the vaccine and how it's come to development. And you heard it there, not for the first time, but repetitively, the vaccine is safe in that regard as well. So in response to that, I don't know if you want to add anything there, Dorian, in regards to experiences you've had in the community. Please let us know your thoughts.
Good evening, everyone. Thank you, Donald, for that really professional talk.
Thank you.
In my experience, I think patients really want this vaccine. Everybody is suffering with this lockdown and these restrictions, and they've almost seen it as a light at the end of the tunnel, that we're getting the better of this thing. And a lot of the people that I've been speaking to every day, ever since it came out, they were like, when is it going to be my turn? Okay, I mean, and as Donald said at the end of his presentation there, there's the data coming out now showing how effective that the vaccine is, not just in trial, but in real world data that, since we've been rolled out the vaccine in December, the vaccine is helping to drastically bring down hospital admissions and the aim of the program was really to try and get the people who are most vulnerable protected right at the beginning. So the elderly, those with complicated medical conditions, and the healthcare workers, because these are the kind of people who are in the front line, who are at risk. And it's really bringing down the rate of infections in those people and the rate of hospitalization, especially in the elderly. So it's been really positive so far, from what I'm seeing on my side of things. But of course, some people are still worried. Some people have questions because it's something that's new, and rightly you should have questions, and you should be able to speak to your doctor about any questions you have about the vaccine. If you have any doubts about it, then by all means, I really welcome people to ask questions about any doubts they have about having the vaccine.
Fantastic. And I think it's on that point of having apprehensions, having questions and concerns. We're here to host that as an opportunity for people to ask those concerns. So, you've heard there firsthand from Donald Palmer through that presentation in regards to the vaccines themselves. Please feel free to post questions, comments on both YouTube and on Facebook, and we'll get to answering them throughout this discussion. It's time to talk. Let's get talking about this, and let's make sure that people are aware of some of the concerns that people will have, and sharing the ideas and expectations that they may well have of the vaccine itself. So let's have that broader discussion. And I think it's great that you've got the panelists that you have here to talk more freely about vaccinations, about COVID-19, explore that, tap into that. We're here to answer those questions. And on that, I think we've got a few questions that have popped up live on the feed. So I think the first question relates back to the discussion from Donald's talk. What is mRNA, and will it affect my DNA or genes?
Okay, so messenger RNA is a chemical that makes protein. So the DNA that we all have, there are genes, and primarily they make proteins, and that protein is what makes proteins is what we call the message. It's called the messenger RNA. But let's give it an analogy. It's a bit like a cookbook. Imagine your cookbook contains the recipes, okay? That's cookbook. Inside the details of that cookbook is your DNA, all right? And in most cases, you don't want to damage the cookbook. So what you do is you make a photocopy of the recipe, or you write the recipe down. That then is what could be an analogy for messenger RNA. And when you make the actual cake, that's the protein. So think about it in that way. And biochemically, the messenger RNA, the photocopy, is not the book. It can't go back to the book. So, and also, the messenger RNA in the two vaccines only make a small part of the viral protein, and then it's actually destroyed. So the messenger RNA cannot alter or interfere with your DNA.
Thank you so much. I love analogies, and I think the book analogy there is a great one. So hopefully that's imprinted on people's minds now. And conclusively, it does not affect your DNA. That's essentially what we're trying to say. It doesn't affect your genes. It's not going to be incorporated into it. And you've got it there first.
I should say, David, sorry to cut you, but as I know, this is the first time it's been used in human vaccination. But I should point out this technology has actually been around for almost 20 years, where people have been doing these experiments in the lab. And I should point out, these have also been tested on animals and have been done, and have been using animals for experimentation, which I know is a matter of ethical debate. But nevertheless, the current rules and regulations before for any product can be given for human, it has to be tested on animals, and it's been used on animals and has been shown to be safe, etc. So while I clearly, and I think Dorian and you and everyone's right, I think it's important we do ask questions more than anything, because it is a new technology and we want to know more about it. And, you know, as I said, I'm grateful to be sharing this platform. But yeah, messenger RNA cannot alter your DNA.
And I think leading to that, you kind of touched on that in terms of this, of the testing of the animal studies, etc. There's a question about side effects as well, and I guess the role of shorter and longer term side effects. I mean, there's obviously a shorter term side effect that we were aware of, and when you are called up for your vaccine, what you'll find is that you will have a list of those associated side effects that we're aware of in regards to the vaccine itself. But I want to throw out to the floor, is any other comments that you would have in regards to the either the shorter or longer term side effects associated with vaccines? Anything you would communicate, Dorian?
Dorian, you're the GP. I can come in afterwards, but you're probably
vaccines are really, you know, a lot of people have had the flu vaccine, for example, and you know, we know it gives you a sore arm. We know that that's probably one of the most common. And in terms of the two vaccines that we're using at the moment here in the UK, the Pfizer and the AstraZeneca one, the majority of people will get a sore arm after the vaccine. There are some other side effects that people may experience, but not everybody experiences the side effects, okay?
Yeah.
And they are well recognized. They were seen in the trials, in the phase three trials that Donald mentioned, and people reported headaches, sometimes people got fever, people got, you know, sore muscles, joint pains, people felt really tired, okay?
Yeah.
The side effects are limited, they're short-lived, okay? They usually last a few days, maximum a week usually, and people get over them really quickly. I think when you're thinking about having this vaccine, you think about, you know, what's the benefit of you having the vaccine? So when I thought about it, I thought, you know, I'm going to be seeing patients. I need to look after people, and then I still have to go home to my family at the end of the day, right? So I needed to try and protect myself from getting this virus, and protect my family. So that was one of the things I thought about when I got it, and stop. You know, I didn't want to give it to my vulnerable patients. So I have to look after people who are really vulnerable, and if they caught the virus, you know. So these are some of the things that went through my head when I thought about taking it. And I thought, okay, yes, I'll have a sore arm, or maybe I'll get one of these other, you know, some of the side effects, but they are really short-lived, and I've been fine. Literally, I didn't even have to take a day off work. You can't tell who is going to get a side effect. You know, it's just important to be aware of it and to discuss it. And if there's anything unusual, there's a lot of enhanced monitoring. You can report the side effects so that we can pick up anything. 20 million people in the UK is probably the rough figure now who've had their first dose of the two vaccines that we're giving out in the UK at the moment. Okay, and you know, a lot of people have had side effects, but I think they're all very short-lived. And compared with the, you know, getting corona, the risk of death, you don't know who's going to die with it. You know, even fit, healthy young people have died with it, right? You don't know who's going to get it. You don't know who's going to end up with long COVID. You know, people have been off work for months. You know, I've dealt with calls of people who've been off this work with this thing for months and months. And, you know, we don't know when they're going to get better. So if you could do something a little bit, you know, I was taught when I was a child, prevention is better than cure. So if you could do something to try and prevent you getting it, apart from socially distancing all the time, because maybe that can't go on forever. We don't know. But, you know,
so it's part of the
that's
solution.
what I say.
It's part of the solution is what we're trying to say here to things. And any further comments on that?
Yeah, I want to comment. And you made some really good points, Dr. Cooper, about the side effects. And one of you've mentioned headaches, fever, etc. And one of the things as an immunologist is that the effects are actually the body's response. So one of the things we should be aware of is about fever. So why do we get hot when we get infected? The body is that's a mechanism the body uses to try to actually kill the microbe, to kill the virus, because microorganisms, germs, don't like high temperature. So the body, that's a mechanism. So the side effects are mostly what you would generally see with an infection. So what a vaccine is doing is mimicking that. And so that's important to recognize. What is also key, and Dr. Cooper is right, I think from what I last looked, over 22 million people have had this vaccine. I think almost 200 million worldwide. And in most cases with vaccines, if you are going to see some really serious effects, and so far that's not has been reported yet, that would normally come within the first few weeks of vaccination. Vaccines generally don't give any detrimental effects long term. If they do, it's normally short term because of the nature of how our body responds to, to immunity. And so it's really important, I think Dr. Cooper is right, the response we make is actually what we would make if we had a normal infection.
I think that's a really good point to pick up on there as well, in regards to the numbers. If you just point to those numbers again, 200 million, you said.
Something in the region of that from what I was looking at earlier today. I was trying to get at the figures.
It's really similar. I ended up with I had to give my I think Bloomberg had a report, but then they wanted me to put in my email address and everything, and I said, no, I don't want to do that.
But yeah, 200 million.
I checked but yeah, I mean, when you look at the UK population is over 60 odd million, so a third of the population has already had one dose. And Dr. Cooper, you're right, because there's also almost, I think, maybe in the region of 1 million, or I can't remember, I was trying to find a figure, have already had their second dose.
Yeah, a lot of people have had their second dose, because we started the program started in the middle of December, I believe.
Yeah.
And yeah, most people had their first dose, because obviously we took the decision as a country, the vaccine group, they took the decision to get as many people the first dose as possible.
Yeah.
To try and protect as many people as possible, essentially.
Yeah. And in my last slide, that's the evidence. So from the vaccines, it's been shown that if you give one jab, it can actually provide protection for a number of weeks, suggesting that approach does work, because initially the study was such that, after 21 days, so the public were generally concerned, well, hold on, we're going now for 12 weeks. And so studies are continuing and the data is being collected, but also the data is being released. And so it's really important, I urge all of us to try and, I know some of the data might be difficult to interpret because it's written in the scientific language. And that's why, I encourage the organizers for putting on these events, is because as the data is coming out, we can sort of look at it as scientists, as academic, and actually try and break it down to exactly what it's saying, so that, our community can get a better meeting and understanding of what it all means.
Definitely. Ladies and gentlemen, you are in tune to Jamaica Diaspora UK Health and Wellbeing Hour. We're discussing COVID-19 and the vaccination. You've got great guests on the platform discussing this evening. We're really enthusiastic, really happy to have them on board talking about COVID-19. And there's so much questions coming through, but before that, I'm going to just invite one of our guests, another guest that's coming on today, to talk a little bit about basically the uptake of vaccinations, especially within healthcare workers. I wanted to just take time just to bring in our guest. Our guest is, I think he's on the line now, so that's perfect. His name is Marcus Riddle, and he is the NHS's Head of Equality and Inclusion Policy and Staff Vaccination Lead. And hopefully there, Marcus, I hope you can hear me. We're going to bring you in now, if that's okay. So tell us a little bit about the vaccine, I guess, within the health sector, because obviously, as part of that lead out, we had healthcare workers high up on the list, as well as the 90-year-olds and those who were in care homes. So tell us a bit about what you found, please. Thank you for joining us this evening.
Thanks very much, David. Really happy to join you. And as I said to you, David, when we had a chat, my family are Jamaicans, and if for all this work I've been doing in the pandemic, I haven't spoken to any Jamaican groups yet, and I think my dad was starting to think this is not right. What's going on? So I think he'd be very happy now to see me speaking to this group today. Yeah, so Marcus Radom, the head of Equality and Inclusion Policy for NHS England, and currently leading on staff vaccinations. And throughout the COVID pandemic, I've been doing a variety of jobs really related to BME staff in particular, and some jobs related to all staff. So prior to vaccinations, I was working on PPE and equity of PPE supplies, fit testing of FFP3 masks. I was working on risk assessment. So, you know, seen a lot of what COVID's impact has been on frontline staff. And vaccinations is interesting because often with these issues, they tend to be seen in a bit of a vacuum. So when the vaccination rollout began, you know, and I say this as an employee of NHS England, there was just a sense that we had rolled it out as if it was something that was separate to everything that had come before. And of course for staff, and this is all staff, but particularly ethnic minority staff, and especially Caribbean and African staff, and I'll talk a bit about the data that we have on what's happening to those staff groups in a minute. This was simply a continuation of all that had come before. So if I kind of give you a context of what I mean, essentially, and how it links to what we've heard so far. Very quickly, in terms of uptake of the vaccine, some of you will know actually it was reported in December before the rollout even started that there was an expectation that uptake would be lower for Caribbean and African communities, Bangladeshi communities as well. And that started to play out quite quickly, even in the older age groups. And it certainly started to play out for healthcare workers. So, you know, the data that we have now shows quite clearly that the percentage-wise, so as a proportion of the denominator, that Caribbean and African staff are least likely, Caribbean in particular, in every single region, least likely to come forward for the first dose of vaccination. And of course, you can expect, not just because of my job, but because I'm of Jamaican descent, people are calling me saying, what's going on? You know, what's happening? You know, how could this be that? What's this about? You know, this is people's professional duty. They should come forward for the vaccination. Shouldn't be a problem. And I've had a lot of long conversations because this is not simply about the vaccine. So if you look back over the last year, and David, you'll know this. You know, we've had issues with access to PPE, issues of access to testing for BME staff. We've had issues around risk assessment. And prior to that, all of our data on race equality in NHS points to ethnic minority staff having a worse experience by almost every metric. And then, I think more importantly for this debate about vaccines, given this is not just about staff, is there's often this kind of, there's a mythical status for the NHS, and that's conferred upon staff as well, which is almost like once you put your uniform on, you're just an NHS worker. And it doesn't work like that because, you know, we're people, we come from our families, we come from communities. And for a lot of us who are Caribbean in the NHS, even for me in my job, you know, leading staff vaccinations, you know, it's not enough for us to just be told that it's fine. So, I wanted to commend you for having these types of conversations because I think we carry legitimate kind of concerns carrying over from, issues during the pandemic and beyond. I was asked last week about Windrush, actually, when I was speaking on a webinar about staff vaccinations, and I said, so I'm 35, right? So, you know, born long after my parents and grandparents came here, but the impact of what happened to them and what they shared with me and some of what I saw when I was a child, and ultimately, unfortunately, what we saw not too long ago when there was discussion of people being deported, and we've been here for 50 years. Those things really affect us. You know, I've been trying to explain this. This affects us. And then you say this vaccine that's been developed really quickly is fine. Well, we're going to need to talk about it because we're not inclined to just trust what we're being told. So these discussions are really important, and that was I really wanted to come to say, from the NHS, there are people that be working here, and there's no stigma attached to people having concerns about the vaccine at all. Actually, I think this is perfectly reasonable. These are the kind of conversations we should have, and we should have them on the terms that people want to have them. So you can see, as you've kind of badged the event, I know you've held events over the last year. a lot of this, as I've discussed, is about not just the actual particular incident, or in this case, vaccination itself, but it's about a whole host of reasons that we need to get out in the open and let people feel free that they can discuss them. Now, finally, it is worth me completely backing up what Dr. Palmer and Dr. Cooper have said. The vaccine safety is a safe vaccine. You know, Donald went through a whole, you know, range of evidence to kind of point this out. And coming from a family of Jamaicans, it's worth me saying that some of the conversations have just been a lot franker than that, because sometimes they have to be. And my father has now been vaccinated, and my mother as well, my grandparents. There were a lot of conversations about this, because I remember when my granddad was offered, he was the first to be offered, he's 86. And he said, oh, I'm not sure about this, you know, I don't think it's right. They developed it too quick, and I don't really trust them anyway, so I'm not going to have it. And, you know, you got to have frank conversations. I said to him, okay, if you want to wait a couple of weeks, what's going to happen? Because I know what you're concerned about, Granddad, I know you will. Lots of white people are going to be vaccinated and they'll be fine. And then you'll be reassured to have the vaccine, because some of this is about, he genuinely just thought, they're going to use me first. They're going to give me this vaccine, see what happens. I said, this is not happening. This is not an unsafe rollout, but we just got to have these conversations. He was concerned that he was going to be the guinea pig. He's not. And now he's seen this. He's like, well, this is fine. So he had his vaccine. No side effects actually for him at all. And he doesn't know now why he was concerned. So, but it's just that he just had that chance to speak to, you know, I work for the NHS. He could speak to someone just kind of on his terms, you know, what actually is your problem? So I just wanted to kind of just give you that kind of personal story here of how it's impacted us. And there are still members of my family, Jamaicans, who are kind of steadfast against this. But I know that with the conversations of the type we're having here, they will come around and realize that this is the right thing for them. Because what we have to say is, people like us on this webinar now, we have been heavily hit by COVID. And if I just kind of tweak what Dorian said earlier, the thing that's the biggest risk to Jamaicans in the UK is COVID. It's not the vaccine, it's COVID. You know, we've seen the data. If we get COVID and we end up, we're hospitalized or we're ventilated, the data is grim. You know, so we've got to just think about it in those terms as well. We're being frank that it's a much bigger risk to get COVID than to be vaccinated. So I hope that all makes sense, and I'll leave it there.
Thank you so much for that. It's touched on some beautiful points there, real good sound bites. I can't even, you know, summarize that. But one thing I will say is that, you know, COVID has shone light on, you know, some of the historical issues that have affected us as a Black community, and I think that's really all that it's done. I think there is issues that have been there for a long while in the offing, and I think through the experiences, and I like the experiences of, I think you said your grandfather. That's just, it makes me smile, because, you know, it's a shared experience. People are worried for lots of different reasons, and have these discussions ongoing, I think, will help going forward as well. So thank you so much. And I'm sure we're going to be talking to somebody in the community who's had the vaccination as well. It's not like there's just one person, but we're bringing on somebody to talk about their experience as well a little bit later in the program. So thank you very much for sharing that that with us. I just want to pick up on a couple of questions that have come through that evening, and I want to make sure we touch on those. The more questions from YouTube. Can the mRNA product produce too much protein, and if so, what would be the implication? I think that's a simple one for Donald to pick up there.
No, it is actually quite a small amount of protein that's produced. And I should also point out, in the animal trials, they actually tested toxicity. So they actually used much more than what was done in humans. And you have to remember, one of the early phases in human studies, which is called phase 1, was to test the toxicity. So does this drug cause harm?
Yes.
And so when those studies were done, and to show, yeah, look, this is safe. And I have to commend Marcus, who gave a really brilliant talk, because it's interesting. And it seems that way, that now that his parents and grandparents have taken it, they seem fine. Which is and it's interesting, they don't have, as he mentioned, they don't seem to have the side effects, which is also evident. I know people who've taken it and they've had no side effects. But no, the messenger RNA is of a quantity that produces the protein that can generate the immune response.
Fantastic. And another lead question, maybe both of you can chime in on here, is can the vaccine stop you from getting it or passing it on?
So that's the data that I showed the last slide. The evidence now, and this data is going to be rolling. One, the evidence suggests now with the single dose, because that was the real question, but the single dose now appears to actually slow down transmission. So what they've been doing, they've been monitoring people and they've been taking swabs. And what they've noticed, those that have been vaccinated, when they've taken swabs, a significant proportion of a reduction in positive swabs that have been vaccinated. So what they've done, let's take a simple scenario. They've looked at people that are vaccinated and they've looked at people that are not vaccinated. And they simply asked the question, how many actually are positive for COVID? And what they noticed in the vaccinated group, there's a lot less, up to 70%. So in terms of transmission, you know, that's the evidence is now showing that. And then Dr. Cooper can probably likely comment on the seriousness of the disease, because again, the evidence suggests that also, you know, in terms of people getting, you know, severely ill, there's also a reduction, particularly amongst the older individuals. And if I'm right, Dr. Cooper, that's the group that were most impacted with COVID.
Absolutely. I think when they came out with the whole priority list of who should be vaccinated first, people were a bit, you know, their eyebrows raised, but they wanted to, the people who were dying from COVID the most were the oldest people, the people with multiple, you know, health problems. And they wanted to target those groups first to try and reduce their risk of dying. And just as you say, as you've shown in the data, it's been in the headlines, it's been on the BBC, it's been all across, you know, in the last few weeks, the data is coming out showing that the hospital admissions are falling very, very quickly. You know, people are not required to go to hospital because of COVID anymore, you know, and even people who so the vaccine isn't 100%, okay? It can't 100% protect you, but even those who get COVID after having the vaccine, and you know, there needs to be sort of a lead time after you've had the vaccine before your protection develops, they don't get as sick with it as somebody who hasn't had the vaccine. Does that make sense?
Yeah,
makes perfect sense. Makes perfect sense. And Dr. Cooper, I just want to ask another question. What would be the top three concerns from people who've come to you for questions about the vaccine or COVID-19? Because obviously there will be people out there who still have lingering questions about it. We've presented really good information for them this evening in the slide sets that were offered by Dr. Palmer, and you know that will help people making decisions going forward. But are there kind of a list of the top three things that you could think of that people have come to you with, questions that they've come to you with, that we can go through this evening?
It's a really difficult question to answer. Everybody has their own personal priorities in terms of what they ask. If I could say there's one thing that is on people's mind is the uncertainty. You know, this is a new virus in terms of, you know, what we're dealing with. And we don't really have any very good treatment to help cure people of it. Hence why we're, you know, why the whole world has almost virtually been locked down, you know, the economy shut down, you know, these are unprecedented steps. You know, it's like we're in war. You understand that we don't shut down the place for no reason. You know, because this thing is dangerous. There's so much that we don't know about it yet, and that's coming up. There's information coming up all the time. And I think that fear, that uncertainty is probably the biggest thing that weighs on people's minds. So is it gonna kill me, you know, doctor? You know, what can I do to help myself with it? And actually sometimes I've felt really helpless because there's not a lot you can give to people. Actually, for a lot of people, you just say, you know, you just have to wait it out and ride it out, you know? And there are some treatments, and you know, as things have gone on, they have got better at treating it and doing different things, and they've tried different drugs, some things that did work, some things that didn't work. and they are better at managing it out and recognizing it, and people, as it's gone on. But I think that's, yeah. I don't have a list of 3 things, but that's the crux of it. The uncertainty, I think, is the biggest.
Well,
this is the
thing. Through having this discussion, I think it will alleviate some of the uncertainty that people will have in the communities that we serve. So, having these discussions, Frank, and that's what we need to do, and that's what we need to continue to do on a personal level, but also on a platform as well. So, thank you very much for answering that question. I think with respect to how things are going here in this discussion, I think it's only right for me to bring on a guest who has had the vaccination and wants to talk about their experience as well. Tonight, we're going to bring on a guest of ours who's part of our Jamaica diaspora community. Her name is Rose Thompson. And Rose, just tell us about your experience, if you will, and we'll take it from there. Thank you so much for joining us this evening.
Yeah, thank you, David. And everyone, it's been interesting to hear your perspective and to see the presentation as well. I come from a family that's been very affected by breast cancer. I lost my mother to breast cancer and my twin sister, and 2 years ago, my younger sister after 13 years. And then I was diagnosed in 2015. So I've been having treatment since then, coming up for my 6th year. And I do have a background in cancer, but I'm actually chief executive of a community organization called BME Cancer Communities. And we deal with the frontline BME and low income households. So I certainly identify with Marcus. We have a family WhatsApp, and it was just buzzing with all that kind of information about microchips and whatever. So it was really important that I find out for myself accurate, up-to-date information. And as somebody who has been affected by cancer, I do know that viruses can actually affect the immune system, and cancer can as well. And also some of the medication that you're on. So my white cells, which are my immune system, are quite low. And I was very concerned when I first saw on the news that Black and Asian and BME people were being affected. So I had to do my homework. And I have to say that when I'm used to kind of the type of vaccination program, because I used to work in the NHS and I used to have to take the flu vaccine. And even when we were going to oncology, the cancer services, at the beginning of the pandemic, the pharmacists had masks and it said, please take one. So I'm chair of a support group as well. So we really started taking note at the beginning, but all of us were really concerned about a new vaccine, because when I had my first treatment, I had to have the dose reduced by 30%, because we do need to kind of tweak things depending on individuals. So it took a while to actually get the vaccine, but I had it done a week last Sunday. But I don't think it's just that people don't want it. One of the things that we find is that not a lot of our people kind of watch the same kind of information and actually have the computers in their homes, or even some mobile phones in some of the most poverty-stricken areas, to actually get the information that is needed. And when I went for my vaccine, I booked it online because I hadn't heard from my GP yet. And we've lost 2 family members within 24 hours of each other. And my sister-in-law has only just come out of hospital after 10 months. So it was quite important that I got it fairly quickly, because I also want to try and get back out in the community and help people as well. So booked it online and got into the city hospital and had it a week last Sunday. And my husband came with me. And not all of my household wanted it either. But one of the things my daughter says to me that I think is really important, she says, I'm going to have it to help to protect you as well. I don't expect people to just follow because somebody's having it. And I always say to people, even about cancer, and there were similar conversations when I first started about doing cancer in the BME community that we didn't get cancer because we weren't seeing it as much. But with this, I think, was it you, David, said that COVID is more risky than the vaccine?
It's been said this night.
Yeah, and we've certainly seen that in our family. And not only that, you know, one of my good friends was affected, and her husband is a good friend as well, and she died in the first wave. And I didn't even know that she had lupus because she was well and it had been controlled for 10 years. But one of the things that the virus seems to do is affect the immune system and give the chance for some of those underlying conditions to take control again. And we've certainly seen it in my sister-in-law, who is a kidney dialysis patient as well. And as a result of everything that has happened, has ended up with advanced diabetes, really, you know, where she might not have had amputations. She's lost 4 toes. Sure. And also had damage to her arm, so that one arm was completely paralyzed, and she developed abscesses, diabetic abscesses afterwards as well. So it's not just the actual virus itself, it's the way that it affects the immune system, because in cancer services, I can tell you that we often see a virus before we see certain cancers, like cervical cancer. There are 70% of cervical cancers. When you look at them, you see 2 types of human papilloma viruses. And viruses are very quick to spread and actually weaken the immune system to allow cervical cancer to take hold. We see the same in some parts of Africa where
Perfect. Thank you so much, Rose.
Well, so I did have it done. Part of my reason was because I'm tired of being stuck in this house, basically. I want to get out and help the community. We've got people who need feeding and clothing, and, you know, so I don't just follow fashion, as we say. We need to understand where we're getting our information from. We need to stop sharing things without looking at it, and actually just get the information from, trust is what it's about. I think Marcus summed it up. There's a lack of trust. And actually,
Rose, can I ask you a question? Because you've got a question that's come in directly. Yeah. Did you have any side effects?
No.
Fantastic.
I actually had the flu vaccine quite late on because I had some issues during COVID. It has been difficult with having cancer, but the flu vaccine to me made my arm ache. This, I was expecting the same thing. I didn't even feel it when it was going in, and I didn't really have any side effects afterwards.
Fantastic. And so, can you remember how long you waited between the 2 vaccinations, between the flu vaccine and
I had the flu vaccine, I think it was about the end of January. Fantastic. So I kind of waited. I was told 2 to 3 weeks, but some people say 1 week. What is it actually?
Yeah, there you go, Dorian. Thank you.
7 days essentially is what we're saying at the moment.
Okay, that's
7 days.
Good to know, because I didn't want to have.
Yeah, it's purely just because you don't want to have. You want to know if it's from the COVID vaccine. If you have a problem with it, you know it's just from the COVID vaccine and not from anything else.
Excellent, Dorian. And I've got another question for you, Dorian, coming up there as well. There's a question relating to liability. And if there's with regards to the vaccine, I don't know if you're happy to take that question.
So the simple answer that I can give is that there is some liability. If you are disabled or have a problem after having the vaccine and it's directly related to the vaccine, then the UK government has guaranteed that there's some liability and in terms of looking after you after that happens, that there's a scheme that's in place to help look after that.
Okay, and I think there's the trickier questions coming in now. I think
can I comment on
yeah, please.
what Dr. Cooper said? Because
please, yes.
Also, if folks do have an adverse effect, and so far that's not been reported, please report that to the NHS, because so the body that I spoke about, the MHRA that I've sat on when we looked at yellow fever, that if there are anyone report any adverse effect on any drug, I should point out, that gets reported, and if necessary, they'll also then look at it more closely. So if there are, and as I said, so far, there's not been.
What I would say, everybody who's given the vaccine is given information after they have the vaccine. So there's something called the yellow card scheme.
Yeah.
That's put up by the organization you spoke out, the MHRA. So it's an online system, and you can report any side effects or any problems that you've had after you've had any drug or any medicine.
Yeah.
But I mean, obviously, this is about COVID, and you could talk about the vaccine and things. But actually, any drug or any medicine that you're taking and you're having side effects from it, it's important to talk to your doctor if there's a problem. But you can also report it without even having to speak to your doctor.
Yeah.
Online yourself, and it's not just online. I think they have like a telephone number as well that you can use.
So that's super correct there. So just to be fact checked, it's yellowcard.mhra.gov.uk. You can put your details in there and put in your side effects, and then that would be lodged by MHRA. So that's fantastic. Thank you for sharing that bit of information. Have you got something else to add there, Donald?
I was going to say, David, sorry, it's just while Rose, I just wanted to made a really good point, and I just want to explain.
Please.
There's evidence now. So you mentioned, Rose, that some people who have other diseases, all of a sudden when COVID comes in, it causes problems. So one of the things people have been identified, and you're right, diseases like lupus and particular diabetes, when you have COVID, causes problems. So what's happening in our immune system is that, and Dr. Cooper can also comment, that with some of these so-called diseases, potential risk diseases, whereby people have been having diabetes and have been manageable for a number of years. Lupus has been manageable for a number of years. But what happens when, sadly, those individuals get infected with the COVID virus? What happens is there's a disturbance of your physiology, particularly your immune system. And what can sometimes happen is that this balance causes adverse effect. One of the things COVID does, and we're trying to understand this, is that your body over-exaggerates. And that disbalance, which is around the immune system, is what you produce what's called pro-inflammatory products. That causes a complete disbalance and can cause problems. So people who've had diabetes and managed it for many years, or lupus or other diseases, once they get COVID, it can cause a disbalance. And that's what people believe is also happening with long COVID. It's one's immune system. And we don't see it in all, but their immune system is disbalanced, and that's what can cause the disease. It's not the virus, but the body's response. And people are trying to understand that now, which is why Dr. Cooper mentioned about certain therapies that worked. One, for example, was dexamethasone, which is an anti-inflammatory agent. The reason why that was able to work was in some patients, that's what was causing the problem. So Rose, I think you really made a really good point.
Yeah, can I just ask, is that similar to chickenpox and shingles then?
Yeah, so what happens if you get chickenpox, and Dr. Cooper can equally comment, as a child, you may get 1 or 2 spots. If you as an adult, it can actually kill you because your body will over-exaggerate, and you can end up with potentially anaphylactic shock. It's a massive response. You may have heard the term what's called cytokine storm. It's seen also in patients who are allergic to certain products. Like for example, I know others who are allergic to peanut, and if it's ingested, they tighten of the chest, etc., etc. And so it's the body's reaction, and that's classically the case if you have chickenpox as an adult compared to that as a child.
But I can speak to that point that you were saying there, Donald, in terms of the patients that would come in to see us in the eye hospital. They come in with reactivations of shingles, and they come in with reactivations of herpes simplex, and it's because of potentially because of lowered immune status, because of what you mentioned there as well. I've got to mention the time, because I know we're only going to stick to time, so we're now 7 minutes over time. But I know the fruitful discussions that we're having now is a beautiful thing. We'll keep it going. There's a question here which is getting more tricky, so people must be firing up things now. So the question is about women of childbearing age They're worried about the impact of vaccine on fertility and pregnancy. I don't know if there's any comments that you would have on either of those two.
Yeah, I can comment on this because what was quite interesting, and I was speaking to some colleagues about this recently. One, there is a clinical trial taking place at the moment, but remarkably, in the early clinical trials that were taking place, some of the women that were involved actually got pregnant, and they're currently being monitored. And so far, nothing adverse has occurred. I should also point out, in animal studies, they actually looked at that question. And again, in animal studies, they didn't see any adverse effect. But in terms of the human studies that were done during the clinical trials, only a small number of women got pregnant, and they've had no impact so far. But clearly with a small number, that's not statistically significant to answer that question. But I know that's something they're now currently conducting trials on.
And Dr. Cooper, was any questions from pregnant women who have come into the GP practice with any concerns in that regard?
So I think the most important thing about, in terms of having the vaccine, if thinking about having the vaccine if you're pregnant, is the risk, and that's probably has to be a very individual conversation. As Donald pointed out, in animal studies and in what we know about vaccines and other vaccines that are similar to the ones we're using now, there's not any known problems in pregnancy. Obviously, the coronavirus vaccine is new, and we haven't tested it on pregnant women. So we don't have enough data yet to 100% say no, but we don't have any theoretical risk that we're aware of. And it's certainly historically, in use of very similar vaccines and products, we've not had any risks or any concerns. But I think if you are pregnant and maybe you work in an environment, so the people who have been offered it when they're pregnant would be people who are at significant risks to COVID because of it. I think you should have a conversation with your, either your GP or your obstetrician or your midwife. But I don't, there's nothing to suggest that there's any harm to babies at the moment.
And Marcus, any answers to that particular question?
Yeah, and I mean, I would just add, if it gives people any reassurance, that the chief midwifery officer, even in England, Jacqueline Dunkley-Bent, Caribbean descent, and one of the senior consultants at the Royal College of Obs and Gynae, Christina Ketchy, of African descent, have both spoke at length about this and kind of stressing to Black women in particular that the risks to fertility here, whilst as Dorian and Donald laid out, are still being investigated. They couldn't name a vaccine that had an impact on fertility. They're both really clear about that. And in terms of pregnancies, Dorian laid out, you should consult your GP. The advice generally is if you're at high risk of COVID and pregnant, then GPs tend to say you should take the vaccine. Otherwise, they say to be risk averse, not. But again, the chief midwifery officer is quite clear. There's not a vaccine that has been created as yet that has had an impact on pregnancy either. So I recognize, I get why people are asking the questions, particularly as, of course, for Black women in this country, the complications around fertility and pregnancy are pretty stark. So I totally get it, but it's just worth us kind of stressing that there is nothing to suggest that this vaccine has an impact on those issues.
Just ties into the open discussion that we're having here about people's concerns regarding COVID-19 and the vaccinations, and I think it's fruitful to have this discussion. So there are more questions coming in regards to the vaccine itself. Should we wait for alternative vaccines, giving us a choice to take the vaccine now? So I guess there's a time limiting here. Should we wait even longer? And I think we've kind of touched on that earlier in regards to the wait, because the longer that we wait for things, there's a likelihood that you potentially can pick up the virus itself and have a worse outcome in regards to it as well. But open that to the floor. What do people think in terms of waiting for vaccines?
No, I think if the vaccine is proved to be safe, as I said, I think Marcus and others, that you've really made out, and I think I share that these are our community have legitimate concerns, and these are real concerns, and that's why I said David and everyone on the group, this is fantastic, because I don't think our concerns have been really addressed. I think Mark has made a good point. Government just rolled it out and that's it. So I think these are important questions. But the point in vaccine choice is such that we can't wait. The numbers are going down in terms of number of people getting infected, but Imperial College London published today that the numbers aren't going down as fast as they hoped it. So the infection is still out there. Okay, and so that's something to bear in mind when we look at the risk. Is the infection is still out there. Schools are going to reopen next week. And so, as what happens the last time, it wouldn't surprise anyone if infection rates might potentially go up. So the virus is still there, and therefore it's really important that if you look at all the information, then you can make an informed choice. But
Fantastic.
I think in terms of vaccine choice at the moment, I don't think people can have a choice. The only choice at the moment that we can give some people is if you have a known history of, I wouldn't even say allergy, I would say it's something called anaphylaxis, which is a severe allergic reaction that probably would have required hospital admission and treatment with adrenaline. Okay, so anaphylaxis to one of the ingredients in the vaccine, or to an unknown substance, or to multiple medications and things like that. Okay, that is the only time that they may consider giving you one vaccine over another. But otherwise, you kind of are offered what you're given.
Thank you so much. And I think final question that's come through was a bit contentious, but I think we should answer it here. Was the government right to delay the second dose? I think actually, Dr. Palmer touched on this about the first dose and how much effectivity that's had in its regard. So actually, it's not so controversial because we've got some of the answers. But please feel free.
But it's also it was actually in the clinical trials. The time between the first and second dose varied. So there were some clinical trials that were actually undertaking to see how long you can actually delay the second dose. And so when people had done the first dose in the early studies, they realized the level of antibody, that protein that can stop the virus from getting inside your cells. Even after the first dose, they noted there was a significant proportion and it could be effectiveness. So on the basis of that, one could actually extrapolate. But as I said, there were clinical trials that were undertaken that did vary the dates and the time between the first and the second dose.
So I know definitely for the AstraZeneca, the gap between the first and the second dose was a lot longer. For the Pfizer, the trials were only really done around the 3-week mark.
Yeah, exactly. The trials were only done 3 weeks, so they couldn't.
And so, yes, they had evidence from the trials to say that there was some protection after I think it's between 14 and 21 days that they noticed that there was those protective levels in the body. Essentially, what they made their decision on was that with other vaccines that were given in the past, one of the things was that they give protection after the first dose. And I think, yes, maybe they were right. They were looking after the greater good. They weren't trying to protect a very small proportion of the population. They were trying to protect as many people. So I think the decision was made in good faith.
Fantastic.
So that's my opinion.
Fantastic. Thank you so much. So I hate to keep going and saying and finally, but there is one final question that has popped up, and that will be the final question tonight. But before I come to the final question, I'd like to say you're on tune to the Jamaica Diaspora Health and UK Wellbeing arm. And we are discussing COVID-19. We're soon to wrap up that discussion tonight. Tonight's discussion has been sponsored by the Jamaica National Society. So thank you very much for sponsoring. Before I get to the final question, I just want my panelists to come up with a minute to a 90-second answer in regards to a message to the Jamaican Black African Caribbean community that we all work for and strive for to sort of passionately to deliver information to. So if you have a short 60 to 90 seconds of a summary of what you would like to say to them in this regard. I can see Donald smiling there.
You should have prepared me, David.
I know. I should have, but I think sometimes it's nicest to think off piste. So the question, however, that's come up, the last question, I think it's a very important question, because a lot of the news that we hear is about new variants and the impact of those new variants. I guess the question is, how quickly is the virus mutating, and does this mean that we might be getting vaccine boosters like the flu jab? And I guess this is a question of opinion to an expect and to a certain degree. But what's the feeling here in regards to variants and how quickly they're sort of changing? I mean, we know that we get flu jabs, and we have changes in the types of flu jabs that are offered each season, depending on how we feel the previous season's gone, etc. So there are different strains that we would get in that regard. But I don't know what the panelists feel in regards to that question.
Well, I can comment. I recently spoke to a virologist and asking the same questions, and it's a difficult one, but it's not surprising. Viruses will mutate, and what viruses are trying to do is they're trying to mutate so that they can have a better advantage. Okay, one, they want to try and mutate so they can escape the host immune system, but they're also trying to mutate so they can infect and the transmission be greater, right? Which is why one of the key things when people talk in general about vaccinating quickly as possible is so that you can prevent the spread and you can prevent new variants. Okay.
Perfect.
As to the timing, that's a really difficult one. But variants, if you look at it logically, variants will come about. And so it will be a case of, and this is from a planet point of view. So this is in the best interest for the world that they can stop the spread of this disease, so you stop any mutants from coming. And I know there's one question in the chat which talked about, about Caribbean and other African countries, will they produce a vaccine? And I'm reading recently about in Cuba, their vaccine is now, I think, in phase 3 clinical trials. So
fantastic.
Are actually, on board, and they're making their vaccine. So, because I think this is not just the UK, it's a world problem, because if a variant comes about that's more transmissible, we've seen how quickly it can, go across. So this is a worldwide problem.
Fantastic.
The other thing is worth me saying quickly is the NHS is preparing as if this will be something that's regular in the way the flu vaccine is, but of course this is still pretty new. So I know there was a question about, why are we vaccinating everyone when actually COVID impacts the older population more? Well, of course, it may well become the case eventually that we only, in the way that we do with flu, say we prioritize the elderly groups to be vaccinated, and we're not so concerned about anyone else. But right now, as Dorian kind of touched on it, there's a lot we still don't quite know evidentially, and it makes sense to vaccinate all of the adult population. And there's now trials for teenagers as well, and it makes sense to plan as if we're going to have to do this again. But I'm sure everybody would agree if we didn't have to go through this regularly, that would be good. But we are at this moment in time.
That is the best way to summarize it. I don't think we want to.
You fail to plan and you plan to fail. So
correct.
Yes.
That's what my dad would say. Yeah.
That's it. Fantastic. So I've given you your warning 5 minutes ago, guys. I'll lead off. I'll lead off with Dr. Cooper, because he's smiling there, so I'll catch that smile.
Gosh.
So just 60 seconds, just something you would say to the Black community at large.
Ask questions. If there's information out there and you have doubts about that information, or you want more clarity, then please ask the relevant people the right questions. So whether that's your GP, there's a lot of information out there. If you want to get reliable information, there's a lot of information groups like this are doing it. you know, there's a lot of good groups out there putting out really good information. And if you want to ask questions, there are a lot of Black professionals out there to ask these questions of on Instagram, Facebook, Twitter. There are a lot of organizations out there trying to address the health inequalities and the distrust that we have historically and trying to empower our people. And I think Rose even talked about, you know, her organization that is really trying to help empower and support people. There's a lot of organizations out there trying to empower and support people. So I say always ask questions. And if you're in doubt, there probably is a charity that is trying to help support people with that problem.
Thank you so much. And Rose, just because Dr. Cooper pointed you out there.
I'm just delighted to be a part of it. And, you know, as I say, and I think somebody else said it, we don't just say we've had it for people to follow us blindly. You know, I think we do need to get accurate, up-to-date information. I think we've had some tonight. So I'm really pleased. And I know that we've got I'm saying hello to Sisters Against Cancer, because some of them are listening as well, and some of my other contacts. And I would have loved to be out at some things for International Women's Day, which is on Monday, but I think the vaccine will help me to be out next year. I trust.
Fantastic. I feel a song coming on there, Rose. Rose is coming
Yeah.
out. I like it. I like that.
Do you want me to start singing? You might regret it. I'll get my piano out as well.
that would take away time from Russell, sorry, from Marcus. So we're going to go into Marcus. What's your take on things?
Yeah, thanks, David, again for the invite. So, yeah, I guess for me, just building on what you both said. So, you know, a lot of our families came here, as I say, sort of 40, 50 years ago, and it was hard work. It wasn't easy by any stretch. Although it's kind of made out now to rose-tinted glasses by some, you know, that it was kind of all wonderful. It was hard, and people worked hard to stay here. And, you know, somebody like myself, you know, I owe this where I am now to my parents and the fact that they fought for the lives that they gave us. And I guess for me, when I think about what's happening now, I just think let's not let COVID be the thing that ends our story of Jamaicans in the UK. We're not done yet. We worked hard to stay here. Look at the great, excellent panel here. Let's protect ourselves. The safest thing we can do, following these discussions and you know, having that informed conversation, is to be vaccinated. And let's carry on as we are. You know, let's not let COVID be the thing that ends, you know, our story for some of us. And, you know, Rose, that testimony you gave about your family, that really just is a reminder for people what happens or what can happen if COVID hits us. So let's not let that be us to some extent. You know, let's listen to what Rose just said. The vaccine didn't come in time for some of us, and David, you'll have colleagues, I'm sure, who it didn't come in time for, and I certainly have. But for the rest of us, when we have a chance, let's come forward and protect ourselves.
No doubt. Thank you so much, Marcus. And the floor is over to you, Dr. Palmer.
Yeah, I was trying to think, I can't, but a minute or so. So perhaps earlier this week on BBC, David Hayward did a documentary, which I guess some of us have seen or we've heard about, and the impact of COVID, particularly in our community. I live in Brent, and he talked about Church Road, where 36 people died, and you know, I soon heard about it. Norfolk Park, a hospital, in fact, where I did my doctorate, was one of the first hospitals in the UK that went into emergency measures. And he highlighted the disparity that COVID has on our community. And the key thing is that there are legitimate concerns of the vaccine, but also about the issues of how we live in this community. And a discussion needs to be taking place, and this is something Marcus touched on, post-COVID. So I think it's important we don't forget that as well. But our concerns need to be addressed. And what I'm really grateful for and humbled for is how the community has stepped up to at least have that conversation. You know, the Jamaica Diaspora, this group here have put this event on so that we can have a discussion, so we can make informed decision. I like to big up the CAHN is another organization that are trying to get the information out there. I would also like to acknowledge my friend and colleague, Dr. Winston Morgan, who just recently made a YouTube clip about safety of the vaccine. I'd also like to big up a group that I'm involved in called the Black Health Group with Dr. Jackie McLeod and Mr. Terence Channer. And what we did was to produce a fact sheet that we've distributed and has been endorsed by a number of people in the Black majority churches, because it's all about information. And it's really important, as what we said, is that we can, make choices. So, I'm grateful to be able to contribute to this discussion, because it's our lives and it's really important.
Oh, thank you very much. And on that fact sheet, can you just point us in the direction where we might be able to get access to the fact sheet? I think fact sheets matter hugely.
Yeah, so that fact sheet has actually now been endorsed by Brent Council. So Brent Council now have it on their website. So Brent Council, I've got a dedicated page, and perhaps David, I can send you the link, and then you can put it on the Facebook page. But that's basically we were approached by a number of faith leaders from the Black majority churches who were getting questions. And so we produced a frequently asked question fact sheet, just about 3 pages. For example, does a common question is, does it alter your DNA? Does it contain any animal products? And the answer to that is no. A wide-ranging questions which our community need answers to. So that fact sheet is available, and it's been endorsed by a number of people, including Professor Dame Donna Kinnear, who has endorsed it, looked at it, and she thought it was something useful to spread out. So that's freely available. And what's great, as I said, is that there are many groups in our community who it's all about, taking responsibility and finding out how we can best support one another. And so that's what we're all doing, and I'm grateful to be a part of it. So thank you.
Thank you. Well, in the spirit of supporting one another, I'd like to thank you all for taking the time out of your busy schedules this evening to come and talk on a topic that affects not just the Black community, but it affects all communities, but in talking to the Black community specifically this evening. I'd like to thank Dr. Cooper, Dr. Palmer, Rose Thompson, and Marcus there. Thank you so much this evening for coming and giving us your time. I have to mention something that's quite upsetting for us here in the Jamaica Diaspora UK, which is that we lost somebody very close to the organization called Sophia Ramcharan. She was the public relations officer. She passed within the last 3 to 4 weeks. I just wanted to say that her legacy that she leaves through her tireless support for our health webinars was very much appreciated, and we send our condolences to her family. And thank you very much for supporting us this evening. Thank you for paying and lending an ear. Thank you for being part of the discussion. We'll continue to have these discussions on COVID-19. We'll continue to have these discussions on the Black community and the health issues that affect our community going forward. But once again, I'd like to thank the panelists for coming this evening, and thank Dr. Kevin Brown for hosting this evening through Jamaica Diaspora UK. Thank you again.
Thank you, everybody. Evening. Thank you. God bless everybody. Take care.
Yes, thank you.
Good night, everybody.